Hello, this is Corinna McVay with SSM Health at Home. Thank you all for joining us. We are going to be giving a presentation today called Signs Your Loved One Needs More Care. SSM Health at Home provides a lot of services, and so one of the services is education to our communities. So I hope you enjoy the presentation. This will go over different things to kind of help you understand and notice the signs of your loved ones that might need extra care in addition to what you can provide them. So we'll go through some options for you, and hopefully it will help you get a better idea of what's available to you medically. So looking at what SSM Health at Home does, we offer a variety of home health services. We're dedicated to helping people remain safe, healthy, and as independent as possible in their own homes. As people age, a lot of different polls and surveys show that a very large majority of people want to age in their own homes. And these services are Medicare, Medicaid certified, and we do accept a variety of healthcare plans. So the goals and objectives of this presentation, earlier identification of health changes and needs. So it's really going to help you to understand how to pay attention and how to look for changes in your loved one that might warrant an assessment of what their health needs might be. Also, it's going to help you know where to go for resources and information. We have a lot of different opportunities in our communities to gather those resources and information. So we'll get you some of that as well. So starting out, how do I determine if my loved one is okay or needs help? This is kind of a difficult conversation sometimes because as our loved ones get older, it's really hard for them to kind of accept and understand that they do need help. A lot of people really just want to keep doing things on their own. They don't want to have to accept the fact that they are getting older and that they do need more care. So a lot of times conversations with your loved ones are important to have to kind of go out in a very subtle way. Starting the conversation early instead of waiting until it's too late and until they really need that service. When you do start talking about what's available to them as they age, it's going to make the conversation a lot easier when it does come to the time where they do need extra care and services. It's always good to gather extra family members when you are wanting to talk about extra care for a loved one. Having a nice sit down, getting everyone's feedback, getting your loved one's feedback on what they feel is appropriate and what they're comfortable with. Knowing some long-term plans is always the best bet so that you're not surprised when you do need it. So looking at the areas of focus on today's presentation, we're going to be looking at medical needs, nutritional, social, psychosocial, physical and mental activity, and activities of daily living. So we'll go over each one of these in greater depth so that it can really help you to assess and understand the situations for your loved ones. So looking at medical needs, this is a very important topic of concern for aging loved ones or loved ones with medical conditions. So the first one there, medication management needs. So what is your loved one taking for medications? Is their health condition going to be changing to where they need to change their medications? Also, another thing that's very important to look at is side effects of their medications. Do you need to talk to their doctor and pharmacist to maybe switch around medications to help them manage those symptoms better? Falls is a very common thing for people as they age, and medication side effects can be one of the #1 reasons why people are falling and hurting themselves. So always making sure that you're talking to not just the primary doctor, but also your loved one's pharmacist. Pharmacists know everything there is to know about the medications that you're taking, along with contraindications, side effects, how to use that medication. So it's always very important to make sure you're talking to the pharmacist in depth versus just talking to the doctor about the medication. Also looking at acute or chronic health conditions. You really want to educate yourself about your loved one's health condition because a lot of people don't understand their own health condition. So if you as a family member or friend or neighbor can help to understand what they're going through, you can act as a support to help them ask questions to their doctor, to help them understand something that might be confusing. So it's always good to be as educated as possible. There's so many times where we run across patients that, we ask them, do you know what this medication is for? And they might know, well, I got to take it because of this. Well, do you know exactly what that medication is doing? And do you know how your health condition is changing over time? It's always good to keep educated on that and be an advocate for your own health. The next one there, terminal health condition. So when you do educate yourself about a health condition, know the long-term outcome. Is it something that is going to be more of a concern in the short term? Or is it more of a long-term health condition to where it might not be as serious? Sometimes people get terminal health diagnoses very quickly to where unfortunately they don't have very long to live. So always having that ongoing conversation with your doctor on where you're at, knowing the end result of your health condition and your loved one's health condition. The next one there, pain control concerns. So this is another really big, important question that I feel that you always need to talk to your provider about and know your loved one's level of pain. Sometimes, depending on the type of condition someone has, such as dementia, for example, that loved one might not be able to tell you they're in pain. And they might act out in other ways that you might not recognize as pain. For example, someone with dementia might start being angry, or they might start having behaviors that are something that you think is just because of the disease, but it might be because they're actually in pain. So talking to your loved one and the healthcare team about how to control those pain issues, the different types of treatments, medications that you can take to control that pain is very, very helpful to know. The next one there, functional or cognitive decline. So understanding the level of decline that a loved one might be experiencing, again, in the short term and the long term, knowing how that decline is going to look like over time and how you can properly help to manage that. Frequent hospitalizations, ER visits, or urgent care visits. One of the prime goals of having home health services is to help to reduce frequent hospitalizations, ER visits, and urgent care visits. Doctors don't want you to be in the hospital all the time. They want to keep you as healthy as possible to reduce the number of visits to the ER or in urgent care. Those wait times can also be pretty long when you go into urgent care or ER. And so when a person gets to that point of needing to get those visits to the ER urgent care, a lot of times their condition is very serious. So we want to try to intervene and to try to reduce the likelihood of them ending up back in the hospital. Frequent falls or fear of falling. Wisconsin was actually rated in 2019, and I'm sure probably again in 2020, the #1 state for most fatal falls. It's a huge concern, and at SSM Health at Home, we do even have a fall prevention program, which I'll be talking about, because we really want to try to educate people on how to reduce falls. A very large percentage of falls are preventable. So helping loved ones to understand, one of the #1 things is to slow down and pay attention. That is the #1 thing you can do to reduce falls. So many times people are in a hurry, or maybe their shoe isn't tied very tight and they just kind of ignore it. Maybe they're not wearing the proper shoes. They have side effects from medications that are causing them to be dizzy or unbalanced. Maybe their medical equipment, such as a walker or a cane, does not fit them properly. So there's so many different factors that really play into falling. So it's one of the things that you want to pay attention to with your loved one. Are they having falls? And look at, if they are, why. For example, in our Safe at Home program, which is the falls prevention program, we looked at a lady's medications list. She was having frequent falls, and we actually, with working with her doctor, had found out that her medications were conflicting with each other and causing those balance issues, blurred vision, attributing to her falls. Once we worked with her doctor and her pharmacist to change and revamp her medications, she stopped falling. Another instance is furniture organization in the home. One person was falling in the exact same spot right around the corner of their bed. The reason for this is because they didn't have enough room to take their walker to that side of the bed. So we helped them to rearrange their room so that they were able to take their walker all the way up to the side of the bed and get into their bed safely. So there's so many different ways that just small changes can make a big difference in reducing falling. That kind of leads into the home safety concerns. Sometimes our loved ones are living in a home situation where maybe they don't have enough railings, they don't have enough grab bars, they have those scatter rugs, which everyone really loves, but scatter rugs are also a very common reason for falls. So getting rid of those scatter rugs altogether, if not making sure that they're very, adhered to the ground, that they're not having those curled up edges. So there's a lot of different things that we look at also in the home to make sure that their living area is safe. A little bit more on medical, the need for adaptive equipment or home health equipment. We have a very large medical equipment department, and we supply so many different types of adaptive equipment. One of the number one things that we do provide people are things such as a reacher or grabber. A lot of people don't think that they're going to use it, but once they get a reacher grabber, they use it all the time. And again, that simple tool can be a resource to use to reduce falls. So there's a lot of even small gadgets and adaptive home health equipment that we can supply. A lot of times medical equipment is also covered through insurance as long as the doctor orders it and there is a medical need for it. So I'd highly suggest that people look into different adaptive tools, equipment, medical equipment for their loved ones as well. The next one, they're incontinence concerns or odors. This can be another huge reason for falls. When someone has to go to the bathroom and they're having incontinence issues, they're going to get up sometimes in the middle of the night and try to rush to the bathroom. And that's where a lot of falls happen because they are in a hurry, they trip over something in the dark. So looking at and addressing those types of concerns, especially if those concerns are changing. So we really want to pay attention to what our loved ones are going through. The next one, there are changes in mobility. Really need to pay attention to how people are walking, their ability to get up and out of chairs, in and out of bed, their vehicles, if they're still driving. So making sure that you're paying attention to how they're moving. Things such as tremors can affect their grip, different arthritis issues. We have a lot of different medical equipment tools that will help with those types of issues, such as adaptive silverware, for example. That can make a huge difference on how a person is eating or feeding themselves. So just paying attention to how people's strength is doing, how their balance is, their flexibility, and really looking at and encouraging them to figure out ways to keep that flexibility and mobility through either physical therapy in the home, exercise programs. So really encouraging loved ones to stay active to the best of their ability to keep them as mobile as possible. weakness or endurance concerns. So again, when they are functioning, when they're walking, when they're doing their daily tasks, do you notice that they're becoming weaker? Are they becoming fatigued a lot quicker? Are they having shortness of breath leading into that next one? These are all signs that they are having more medical concerns that they may not be able to take care of on their own. Especially with diabetics and congestive heart failure issues, looking at swelling problems. A lot of times in the feet, the legs, the ankles, even sometimes in the arms and the hands. So that could be another very common and important sign that your loved one might need to be reassessed by their provider to see if there's any other medical options that they need to have help with. The last one there, weight loss or gain. So making sure that if someone, especially if they do have a current health condition, to be monitoring their weight. Sometimes we just wait until we go into the doctor to take our weight, but it's always good to have a scale and to know how a person looks. Sometimes someone might be losing a lot of muscle, and that is also then creating that weakness. So looking at and keeping track of weight loss or gain. The next slide here, we'll talk about nutritional aspects. So changes in appetite, again, very common, especially when someone develops a new health condition or their symptoms are changing with their current health condition. Either they're feeling that they're just not hungry at all, so that their decrease in both food and liquids are decreasing. So really finding out, why are they not hungry? Are they feeling sick, or do they literally just not have an appetite? Are they maybe taking a medication that causes appetite decrease? There's a lot of different reasons for changes in your appetite. So paying attention to how they're eating, what they're eating is also very important. We see a lot of people that, especially as they age, there's a lack of food preparation if they are still living on their own, if they don't have anyone to help them with food preparation. Another thing is that people are eating very unhealthy because they're looking at food options that are just easy and that they don't have to take time to prepare. So nutrition is extremely important as we age. We know our bodies lose a lot of nutrients as we age. And so having a proper diet, a very well-balanced diet, can actually help to make our chronic health conditions better. A lot of doctors say that food is medicine. We've seen so many different chronic health conditions change just by changing someone's diet, having them eat more nutritious foods, and sometimes even eliminating foods that might appear as healthy, but they are actually not healthy to that specific person. Sometimes people have a lot of food sensitivities. For example, celiac patients have to stay away from gluten. Some people don't have celiac, but they do have a gluten sensitivity. There are also food groups that are more inflammatory to some people than others. So when we're looking at patients that have arthritis, sometimes providers will put them onto an anti-inflammatory diet. It's very important to talk to a nutritionist or dietitian when you are struggling with a health condition to know the best diet for that condition. We have a lot of people that are having nutritional issues, so maybe they're trying to eat healthy, but they're having those reactions from food, such as diarrhea, constipation. When you have reactions to food, it's always best to talk to your doctor about why you're having those reactions. A lot of times people think that food allergies are only something that if you eat something, you're going to get a rash. But a lot of times people can have food sensitivities that are more internal. So even if you're eating a food and you're not getting a rash, it doesn't mean that you're still not sensitive to that food. So paying attention to your loved one's symptom changes and really focusing in on how you can change their diet to help with their health condition. The next one there, fatigue. So a lot of times people's blood sugar might be a huge factor into their nutritional needs. So obviously knowing that many patients might need to eat small portions throughout the day to help to keep their blood sugar at an even level to reduce fatigue. Another really important one, especially for older adults, is the need for dental care. A lot of times dental care is definitely not covered in Medicare benefits. So it depends on the plan that they have, but a lot of times our older adults and our loved ones are not getting the proper dental care. That can create a lot of additional health conditions. It can cause pain. And it can cause that person to not even want to eat. So making sure that they are keeping up with their dental hygiene. Again, the last one there we talked about a little bit already, but medical also overlapping into nutritional with the weight loss or gain. So assessing social needs. So a lot of people, when they do develop health conditions that can lead to depression, they will isolate themselves. Right now, more than ever, dealing with COVID-19, we see a lot of our loved ones in isolation because they have to be. So looking at if there is not a factor that's making them isolated, why are they becoming isolated? It can be because of their health condition. It can be that their health condition is making them depressed. So do we need to intervene and start helping to find them resources to encourage more social activity? Social activity has a direct connection with brain health. So we want our loved ones to be engaged. When you're more engaged and you have that social interaction, you're less likely to be depressed and you're less likely to have that loneliness. Sleep pattern changes. So going in with depression, our loved ones can start sleeping a lot more than normal, or they can stop sleeping as much. They can have limited amounts of sleep. And limited amounts of sleep, if we're not getting at least 7 to 9 hours, depending on the individual, a night, it can lead to a lot of health conditions. There's a lot of different things that have been shown to be more common in people that have a lack of sleep. Especially even immune function. People that have poor sleeping patterns can also be more susceptible to those chronic health conditions such as diabetes, heart conditions, and things like that. Social incontinence is on a social aspect as well, because that might be a reason why our loved ones are not wanting to engage and be at social functions, because they're embarrassed of their incontinence and those types of problems that they're experiencing. They know they might have to go to the bathroom a lot, or they know that if they eat something wrong, they might have an immediate reaction. So it can be very hard and a struggle for people to deal with the issues that they're having around large crowds, or even around us as their own loved ones, family, friends. That embarrassment might be a big holdback for them. The next one there, depression, we talked about that already. Just looking at the signs and symptoms of why a loved one might be depressed. Really talking with them, and not just talking to them, but making sure that you're listening and creating that comfortable environment so that they are willing and they want to share with you their feelings. Letting them know that you're there for them. And although you may not know exactly how they're feeling, or you can't really know exactly what they're going through, just reminding them that you're always there to listen can make a huge change for anyone that is struggling with depression. The last one there, looking at people that are isolating, they're no longer interested in activities that they used to enjoy. So paying attention to your loved ones, maybe a grandma or your mom always used to go to church every Sunday and Wednesday. Now all of a sudden she just doesn't want to go anymore. Looking at shopping or visiting others, inviting others to visit. So paying attention to things that you knew that that loved one always liked doing and, really regularly used to do. If those activities start changing, it's really good to just kind of fund the underlying reason as to why they decided to stop doing those things. Sometimes it can just be loss of interest. Maybe they, decided to stop doing one thing because they realize that they enjoy doing something else. So if they're replacing it with a new activity, that might not be of concern. But it's basically paying attention to your loved ones if they start withdrawing in many different activities and they're not replacing it with something else. So psychosocial, again, depression, looking at fear. A lot of people, as they're aging, as they're dealing with health conditions, have a great amount of fear. And that really comes from the unknown. They really don't know what's going to happen. So that's why it's even more important to educate yourself on changes. You want to educate you and your loved one on what's going to happen. Have a plan. When you have a plan in place, it greatly eliminates that person's fear. Writing things down so that if they do become fearful of what might happen to them, they can look at those notes to reassure themselves that you have a plan in place. But fear is very, very common. Again, making sure that you're telling your loved one that you're there for them. You're going to be there to support them no matter what. You're going to listen to what they want. You're going to listen to what they need. Reassurance can greatly reduce fear. If that isn't enough, a lot of times a therapist might have to get involved in helping to get them to understand their fear and to talk through things on a more professional level. Loneliness, overall loss, anxiety, these three definitely come into play when someone's health condition changes or when their living environment changes. It's very hard to go from living in your own home to maybe having to transition into a senior living facility, assisted living, nursing home. Those changes can really bring a lot of emotions up for people. So it can be really hard for them to deal with those changes mentally. So again, making sure that you have a plan, making sure you talk through the changes with your loved one can really make a huge difference to help them to be more confident in what's going to be happening. Limited social network. This can be very common for people living on their own if they're still in their own home and they're not very easily able to get out and about and increase those social networks. Another thing is as someone ages, they're starting to lose more friends. That's a very common thing that can trigger depression and for them to start realizing that their network, their social network is becoming small. Because a lot of their friends, their neighbors, maybe other family members are around the same age or older than them. They're starting to see more of those people passing away. So sometimes that can be a barrier that you might want to pay attention to as well. Are they losing people? Lack of family support. Maybe they don't have enough family to be there to support them. Maybe their loved ones are friends and neighbors, so they really rely on those people to help them with support if they have lack of family members. The bottom one, their recent deaths and grief. So again, paying attention to how your loved one is feeling if they have been losing family, friends, neighbors. Grief is a very hard thing to deal with because there's so many different levels of grief. Sometimes people start out angry, sometimes they start out depressed, and it's almost like a roller coaster of emotions. Grief is not a one level type of system. It's got a lot of ups and downs, and it can be very confusing for some people. Grief is also, it doesn't have a specific timeline. Someone might grieve for a month. Someone might be grieving for 6 months. Someone might be grieving for years. So it's different for everyone. Everyone reacts to grief differently based upon their experiences, based upon their support system, based upon their mental status, based upon their own health conditions. So not one person is going to grieve exactly the same. Physical and mental activity. So looking at exercise, we know how much exercise plays a huge role in our health. So if someone is having health conditions that prohibit them from exercising, that's something that you really want to pay attention to because it can make their health condition even worse. So talking to their doctor about how they can somehow keep some sort of exercise routine. There are a lot of people that would go for walks every single day. Well, maybe they had to have surgery. Maybe they've had arthritis. Maybe they have more health conditions where they can't go for walks every day. But trying to talk to their providers and talk with your loved one about what they can do instead of walking every day. It's always good to have some form of exercise as much as possible. That also leads into changes of range of motion. Again, maybe they are not able to move their arms as much as they used to be. So maybe they have to give up certain types of exercises. Maybe the range of motion in their legs is not as good as they used to be. So paying attention to ranges of motion and different things such as how someone's moving can also signal a new health condition. For example, in some health conditions, such as Parkinson's, one symptom is a person might not be moving their arm as they're walking. So that's just an example of things that you can pay attention to. Someone may be having tremors. Maybe you're noticing that their hands are shaking, their legs are shaking more. Keeping attention to the different types of changes regarding movement. The last one there, cognitive changes. So, some sort of memory loss can be very common for people as they age, but looking at memory loss, if it's actually interfering with their daily life, if it's something that you feel is a greater concern, maybe our loved one went to the grocery store and got completely lost on the way home. That's not normal memory loss. Forgetting someone's name every now and then, that's normal memory loss. So there's a lot of different tests that you can go online and just questionnaires that can help you to maybe assess in your own individual way your loved one, or if you think it's more of a serious concern, making sure to get them to their healthcare provider so that they can actually administer a more in-depth memory test. Cognitive changes can also be a sign of other health conditions, not just Alzheimer's or types of dementias. So we want to keep track of how our loved ones are thinking, how their alertness is, their recall. I always encourage people to go online or look up books on brain health games, looking at different things that you can do to help to trigger improved memory, recall. There's a lot of different things out there and available for people that you can do as brain fitness. We want physical fitness, but we also want mind and brain fitness. It really makes a difference for a lot of people. Learning a new task, learning a new card game, learning a new board game, all these things can really attribute to better brain health. So we always want to challenge our loved ones to learn something new. It's always going to help as we age. So looking at activities of daily living, these are the things that you want to look at as to how we can help our loved ones. It's kind of a wrap up of what we've already talked about, but do they need someone to come in the home and help them with specific things? If a loved one is not able to be there for them as much as they need, do they need someone to help them assess their living situation because of safety concerns? Do they need help with home chores? Maybe they're not able to do laundry. They're not able to clean their homes or do the dishes or things such as that. Do they need a companion? Loneliness and depression is very, very common. So there are a lot of companion services out there as well. There's a lot of volunteer services that are available that actually provide that companion care. Transportation is another really important thing that even here in Dane County, in the Madison area, that people struggle with. There's not enough transportation when it comes to getting our loved ones to medical appointments or social activities. So trying to figure out the best transportation needs for your loved one, doing some research, the Aging and Disability Resource Center, senior centers, there's a lot of different resource centers out there that can help you find transportation assistance. The next one, medication assistance, whether that be devices. A lot of times people will use a pill box, but that might not be enough for a loved one. Maybe they need an automated pill box to where it has reminders on them to take their medications. It dispenses their medications for them in the proper dose and in the proper order. So medication assistance, even when it comes to maybe having a pharmacist regularly review their medications, their side effects, their contraindications. A lot of times people will take a medication for a period of time and they no longer need that medication. So it's very important to assess what they're taking, making sure their doctor knows what they're taking, and making sure that they know they might not need that medication anymore. So that assessment is very important. Bathing is another big concern for our loved ones, especially if their bathroom areas are not safe for them any longer. You know, we talk about people getting rid of their bathtubs, installing grab bars so that it makes it safer getting in and out. But a lot of times when someone is dealing with extra health concerns, they're gonna need that extra hand and that extra bathing assistance. Financial or benefit assistance. This is another big area where people get confused. There's so many different insurance plans out there. There's so many different benefits that you're eligible for based upon your age, based upon your income. So being connected with someone such as the Aging and Disability Resource Center, they specifically have people, a benefit specialist that will help you figure everything out. So we always highly encourage people to go to the ADRC to get assistance with financial or benefit assistance. Next one, errands or shopping assistance. There's a lot of home care agencies available that will help you with errands and shopping. It will create a huge relief for your loved one so they don't have to worry about going out and getting those things on their own. Personal emergency needs. We talk to a lot of people about making sure that their loved ones have some sort of personal emergency response system. So things such as Life Alert, Lifeline, there's many different options. Again, talking to the ADRC, the Aging and Disability Resource Center, they can be a great area to contact so that you can find what personal emergency response system works best. At SSM Health at Home, we have an emergency button that is called Voice Care. And a lot of times people think, well, I have my cell phone. If there's an emergency, I can just call 911. We always tell people that that is not always going to be the safest option. When you're having an emergency and you're on your own, it's going to be a lot harder for you to grab your cell phone, you know, find it first of all, and then open it up and dial 911. If you have a personal emergency response button, all you have to do is press that button. It's available in a necklace or a bracelet. So I'd highly encourage people to talk to their loved ones about getting that type of system. The last one there, meal preparation assistance. You can contact companies that offer Meals on Wheels. SSM Health at Home offers Meals on Wheels for the lunchtime delivery in the Dane County area. Mainly Madison, Sun Prairie, Monona, and Middleton. Outside of our area, there's a lot of other Meals on Wheels options, a lot of home delivery services, and a lot of home care agencies that come into the home and actually prepare the meal for them. So that is a very important aspect, especially when we're looking at the needs of proper nutrition as our loved ones age. So looking at how often all of these things need to be reevaluated. So this can greatly vary depending on the person. Sometimes all of these different levels of care need to be reevaluated maybe every 3 months, maybe every 6 months, maybe every year. It really depends on the person. The biggest thing is to know, are they having a change in their health? Have they developed a new health concern? Are they developing more symptoms? So making sure to pay attention to that. If you see a change, all of the things that we just went through should be reevaluated. So that's just a suggestion. 6 months, I would say, is typically the average that people reevaluate their loved ones. But again, it just depends on the person and what they're going through. So there's a lot of different skilled care options. There's so many new home health agencies that are coming about. So it's always good to do your research and know what each home health care agency provides. Before we looked at the different home health services, types of skilled care in addition to home health. So transitional care is provided for those leaving the hospital or nursing home and need assistance with that transition from home, transition to home, or are ending skilled services and need the assistance with transition to their daily routine. It can be really hard for someone coming from a nursing home where they're used to someone constantly being there for them every day and doing things for them, going home and figuring out how to do things on their own and developing a new routine. So there is transitional care available to help them to easily, smoothly transition from one facility back home. Supplemental care is those who qualify for and are receiving skilled home health care services, but whose day-to-day needs are higher than those which are covered by Medicare. Some people, they might be receiving skilled home health, but their insurance doesn't cover everyday visits, depending on the need for things such as maybe wound care. Maybe their wound is not as serious, so a skilled home health does not cover every single day care. So there's a lot of different options when it comes to supplemental care. Independent care, those whose condition does not qualify them for skilled services, but who may have a chronic condition, disease, or injury, which requires increased day-to-day support due to physical conditions, cognitive need, or medical conditions. Again, it's very important to talk about all your options with a social worker, with a caseworker. They are there for you to go over everything available. It can be very overwhelming for our loved ones to know what to do on their own, or for their loved ones to help them with these different choices. So I'd always encourage people to contact a social worker, talk to your provider about who you should talk with as well. They're really great at referring to different resource centers. So skilled home health is a service to where nurses, a very large team, therapists, social workers will actually come into wherever you call home to help patients recover from an illness or injury in order to regain independence and become self-sufficient. So the whole goal of home health is to get you better so that you are more independent and you can stay at home as long as possible. Trying to reduce those hospitalizations, trying to reduce the likelihood of having to go into a nursing home. Home health will have a whole care team that creates a plan of care for each patient. Each plan of care is going to be completely different depending on the health condition that an individual is dealing with. So home health is a great resource. I'd highly encourage anyone to talk to your doctor about home health and the qualifications. There are a lot of different home health options out there. So knowing what your options are, doctors will always tell you the different choices that you have, and some home health agencies have more options than others. So it's good to talk to your care team, a social worker, about what the best agency is for you. So looking at what's involved in home health, with the care team, it's typically comprised of RNs, home health nurses, NPs, physical, occupational, speech therapy, medical social workers, home health aides. There's a lot of different parts in home health. A lot of home health agencies even offer specialty programs such as palliative care, chronic disease management, telehealth monitoring, different therapies for infusion and wound care. So it's a very, very broad array of services. And a lot of people don't realize how much they can get from home health. So for those of you that are not familiar with what palliative care is going to help a patient facing chronic or quality of life limiting illnesses with a focus on the relief of symptoms, pain, and stress. So it's a really great program for symptom management. You're palliating symptoms. So you're helping someone deal with their chronic health issue, and the goal is to ease and prevent suffering while offering patients the best quality of life possible. Palliative care, this is important to note, can be provided alongside curative treatments. So maybe you do have a very chronic health condition to where it's very serious, but you're still receiving those treatments. Palliative care can be provided in addition to that. So a lot of times people get palliative care mixed up with hospice. So palliative care and hospice provide comprehensive coordination or pain control, family support, and care of psychological and spiritual needs. The difference between the two is palliative care will care for patients at any stage of illness without having to forego curative treatment. Hospice, on the other hand, is caring for patients at end of life, where their doctor has given them a 6-month prognosis, to where they're telling them they think they only have about 6 months left to live. So that is a very big difference between palliative care and hospice. We do see a lot of patients that sometimes, go on hospice to where they could have gotten palliative care a lot sooner to help with that symptoms and help with that family support. So please always keep hospice and palliative care in mind. Palliative care can come a lot sooner than hospice needs. So what is hospice? Hospice is not a place, it is a service. SSM Health at Home has been providing hospice services for over 25 years. We're in a very large part of Wisconsin, and it's for patients with limited life expectancy who no longer want to receive curative treatments for any terminal illness. That is a big part of what hospice qualification means. Focus is on managing symptoms, pain, and stress in order to help patients achieve the best quality of life. We receive so many testimonials from our hospice patients and their families. The families, are just more than happy to share with us how much we've helped their loved one and help to take some of the stress off the family, knowing that their loved one has a huge support team to help them through their end-of-life transition. So whether it's spiritual support, whether it's medical support, social work support, there's so many different aspects. We even have a lot of volunteers that will come and just spend that companion time with hospice patients. We highly encourage everyone to educate themselves on what hospice is early on, and talk to your loved one about hospice so that when it does come time for it, they're not scared of what hospice means. So many people think that, oh, I'm going to go on hospice and I'm going to immediately pass away. While that is possible, a lot of times people can be on hospice for several months. Sometimes people can go off of hospice and come back on hospice because maybe their symptoms are improving to where they don't need that extra support. So SSM Health at Home offers a lot of different services where people can easily transition through home health, through hospice. We provide medical equipment, so that is an extra support. So there's a lot of different options out there, and it's always good to know what is available. Hospice care team involve medical directors, nurse practitioners, case managers, nurses, medical social workers, aides, grief and spiritual counselors, hospice volunteers, different types of therapists. We do have a specialty program across home health and hospice called the We Honor Veterans program. It's a really great program for any veteran patient. And it's basically different levels where our team is taught about different issues that veterans may face, not only dealing with a chronic health condition, but also at end of life. A very large part of that is how to communicate with veterans dealing with a chronic health condition or at end of life. This program has been such a huge help to how our care team manages and cares for our veterans. So it's a really great honor that we're part of this. So looking at the hospice team's responsibilities, they're going to manage the patient's pain and symptoms. They assist with the patient with both emotional and psychosocial and spiritual aspects of dying, provides needed medications, supplies, and equipment directly related to their terminal condition. They coach the family on how to care for the patient. A lot of education is done in hospice. It really helps to provide direction to the family on how they can help in addition to our care team. We help to make short-term inpatient care available when pain or symptoms become too difficult to manage at home or the caregiver needs respite time. We also provide bereavement care and counseling to surviving friends and family. That's another great thing about our hospice as well, is we provide over a year, 12, 13 months roughly, of that grief and bereavement support to the loved ones of the family member who've passed. It's included in our services. So that counseling and that one-on-one phone calls have been a huge help for a lot of people trying to understand the grieving process when their loved one passes away. Our medical equipment department is CHAP accredited. It provides product and services such as mobility aids, oxygen and respiratory therapies, patient room and home safety equipment, nutritional supplies, mastectomy fitting and supplies, and rehab equipment supplies. We deliver to a large part of southern Wisconsin, and people can come into our various showrooms to pick up their medical equipment. We help them with fitting for medical equipment. We can even custom order specialty products if we don't have them in. So looking at special orders of specific medical equipment is also an option as well. Our infusion pharmacy care team is involved with clinical pharmacists, home health nurses, pharmacy techs. So providing infusion therapy right in the home is also an option for your loved one. Therapies such as antibiotics and pain management, nutrition services, immune globulin, these are all provided as an in-home infusion service. Some of the community health programs, and we'll talk about each of these in greater depth. SSM Health at Home does provide a Safe at Home program. It's a fall reduction program and available to anyone in Dane County of the age 60 and older. We provide the Meals on Wheels program, we have the voice care, and we do offer foot clinics. SSM Health at Home offers the Safe at Home program in conjunction with United Way of Dane County. What this program involves is a home safety assessment. We come in and do a completely full assessment of someone's home, looking for any safety and fall hazards, whether that be the kitchen with rugs, the bathroom. The bathroom is a huge area that people experience falls. Literally from top to bottom, we do a home safety assessment, and then we provide you with suggestions, recommendations on how to change things in your home to provide a safer environment. We look at medication review. This is huge. It's a very important aspect, again, looking back on those side effects of medications that contribute to greater falls. We help with safety aids, recommendations, resources, and information. And a really great part of this program is that it does also include 6 months of follow-up after the assessment. So we're always trying to check in on the people that we have had in the Safe at Home program to make sure that they are able to follow through with the recommendations and see if they need additional resources. It is focused on the prevention and reduction of falls and adverse drug effects, and then also, again, free, no obligation for anyone 60 and older in Dane County. Meals on Wheels, we do offer the noontime delivery of Meals on Wheels Monday through Friday in Madison, Middleton, Monona, and Sun Prairie. Meals on Wheels also offer a safety check for people. So loved ones will have that opportunity to have that person deliver their meal, but then also have that social interaction, and those people and volunteers are going to be checking on them. If someone does not answer the door for their Meals on Wheels, we do call them at the number they provide to make sure that they're okay. If we cannot get a hold of them, we call back to our headquarters for the Meals on Wheels, and they follow up to make sure that there is not an emergency with that person. So that safety check can be a really important thing, especially because a lot of times our loved ones don't see people every day. So that Meals on Wheels delivery might be the only person that they see in that day. Voice care, the technology will link to your cellular phone. It will link to a landline. It can include fall detection. There's a lot of different options in voice care. It's also installed by SSM Health at Home, and customer service is really great. If you have any issues with it, a technician will help you through it. It's very easy to get set up. It's also very easy to operate, and there's an immediate notification to monitoring personnel in case there is an emergency. You can also list various emergency contacts, so maybe you don't technically need 911, maybe you need them to call a family member for you or a neighbor. So it can provide a broad range of assistance to you. So what if your loved one doesn't need skilled care? So maybe they do have a health condition, but they're really able to do most things on their own, and they don't need that highly medical aspect, a high medical aspect of care. So something called custodial care or non-skilled care. You also might be hearing it as home care services. So these are agencies that help with assistance with daily living activities. They provide medication assistance, transportation, medication preparation, exercise assistance, home safety, and health service coordinations. So home care agencies or custodial care is typically something that is paid for out of pocket. Skilled home health services are normally covered by insurance. So that's a really big difference between the two. There's a lot of options out there when you research home care agencies. So again, it's always best to know your options and know what each agency provides so that you're able to make the best decision in going with a specific agency. One other resource that SSM Health at Home offers you if you do think your loved one does need greater assistance is informational calls with a medical social worker. There's no cost or obligation to these calls, and they can assist with immediate needs or future planning. So maybe you just have questions about what home health is. What it all entails, what insurance covers, what eligibility means. So you can request a call from one of our medical social workers by calling 800-924-2273. There you will be connected, and you can request an informational call, and it can be a really great help for you. Again, it doesn't have to be an immediate need. Maybe you're just trying to collect information right away so that when your loved one does need more care, you're going to have everything already available, and you're going to already be educated on the resources that you might need to take advantage of. So if you do have questions, always reach out to us. SSM Health at Home is more than happy to provide that extra care for your loved one. Thank you so much for participating in this presentation today, and I hope everyone stays well.